I'm Dr. Jane. I'm a naturopathic doctor and a natural fertility expert. I help couples who have been struggling with infertility for over a year get to the root cause, heal, and conceive naturally. On this podcast, I talk about all things natural fertility because I'm on a mission to help you feel more empowered and take control of your fertility journey. I believe that pregnancy is a natural process, so if it's not happening, something is missing. And we need to dig deeper to understand what that is. A lot of you guys are getting such BS answers through your conventional doctor. You're not getting any lab testing done. You're being sent on this wild goose chase hunt. And my hope is that I can help you make sense of what's going on by educating you and empowering you through the process so you can advocate for yourself when it comes to taking control of your fertility journey and knowing what the right next step is for you. And today's topic is going to be on reproductive microbiome. You guys, I feel like this is something that's not talked about enough. And some of you might be like, what's reproductive microbiome? I've heard of the gut microbiome. Does the reproductive system have a microbiome? Yes, it does. And I think it doesn't get enough attention. So what I always say is you need 4 things in order to be able to conceive. You need a good quality egg. You need a good quality sperm. You need the desire to have a child with one another. And you need the baby room to be ready. And the baby room is the womb, the uterus, the first room that the baby will grow in. And that is, ladies, your reproductive microbiome. We are basically walking bacteria. We have trillions and trillions of different kinds of bacteria that our body is made up of. And our gut has its own little microbiome. Different areas of the gut have different bacteria that are supposed to be more dominant or less dominant. And this is true for our reproductive system. Everything from our vagina to our cervix to the uterus, the fallopian tubes, the ovaries, everything has its own little microbiome. And this microbiome actually shifts a lot during pregnancy. And no, it doesn't really matter if you've only been pregnant for 6 weeks or 8 weeks or 12 weeks, or if you happen to carry to term. Of course, the shift in the microbiome is not going to be as drastic if you had a miscarriage, let's say at 8 weeks, versus you carried all the way to term and had a healthy baby. But there is still a shift in your microbiome because there's a huge shift in your hormones. And we need to start paying attention, or at least talking about this, because I have a lot of women who come to me who have had a history of urinary tract infections, or history of candida yeast infections, or bacterial vaginosis, or even STDs or STIs, or LEEP procedures, HPV. And they were just totally brushed off like, oh, it has nothing to do with your ability to be able to get pregnant or to stay pregnant. And to me, that's always concerning. Like, what do you mean it doesn't have anything to do with me getting pregnant or staying pregnant? A lot of these bacteria, for example, when we're looking at HPV or any STDs or STIs, this is pathogenic bacteria. Pathogenic bacteria is not good. Your body is out of balance. There's too much of the bad bugs and not enough of the good guys. And that's going to jack up your immune system because your body has processes to say, well, we need to get this out. This is pathogenic. This isn't supposed to be here. And so now your resources, instead of going towards hormones and building a good quality egg or even giving you energy, all of those resources are going towards dealing with this infection. And it doesn't matter where the infection is. You don't have to have a sinus infection or cold and flu symptoms. Hell, some of my patients don't even really have a lot of symptoms when it comes to the reproductive system, meaning they're not having burning urination or any itching or discomfort, but it just feels like something is wrong. And when we do some testing or we look at the pH, it's really off balance. And so it's one of those things that the body has kind of just adapted, and it's this low grade chronic inflammation that's causing a lot of issues for the body because the nutrients that your immune system needs in order to deal with this infection, a lot of them are the same nutrients that we need for good hormone function and for good quality eggs and just energy. Think about vitamin C, vitamin E, vitamin A, selenium, zinc, vitamin D, not to mention thyroid function. So a lot of the stuff that I mentioned is like, this is really important for thyroid. And when I see thyroid that's not working well, I'm always thinking, where are the nutrients? Is it actually the thyroid is not working well? Or is it that all of the nutrients are going somewhere else and the thyroid is just kind of getting forgotten by the body because there's other more important things to deal with. And I find that's usually the case. A lot of the times there's an infection or there's things that are going on that are really important that the body just is like, I don't have time to deal with this. The thyroid is going to get the last little bit of nutrients that I have left, but everything else is going to go towards dealing with this infection. And so there's different practices that I use with my patients. So of course, there's things that we want to do short term. If you have an yeast infection or a urinary tract infection or bacteriovaginosis, there's things that we want to do short term to nip that in the bud as quickly as possible. Most of my patients, if in fact that was a chronic issue for them, they want to try to avoid antibiotics because they've already taken a bunch and it doesn't really work. And these infections keep coming back because yes, there's time and a place to use for antibiotics. Don't get me wrong. There's absolutely time and place. But if we have to rely on antibiotics all of the time, what's happening is antibiotic stands for anti-life. So it's killing everything. And yes, it's killing some of the pathogenic, but it's killing a lot of the good guys as well. And your doctor is not like, hey, take this round of antibiotics, and then you need to go on really high dose of probiotics and do this gut healing protocol to make sure that you support the good microbiome rebalance. That's not happening. And so these women are being put on really high dose antibiotics 5, 7, 10 days. And then a month later, they need to do it again because now they wiped off not just the pathogenic, but then they wiped off all of the good stuff, which just predisposes them to the pathogenic overgrowth again. I always say there is opportunistic bacteria. If there is an opportunity to overgrow, they will overgrow. And when is there an opportunity to overgrow? When there's not enough of the good guys. And that's going to come a lot from your diet, from your lifestyle, how much you're sleeping, the different types of foods that you're eating, the stress levels that you're under. And some of it, I don't want to say it's genetic, but we actually pass on our microbiome during pregnancy. This is a line of research, but babies, when they're born, they're not sterile. They actually have a microbiome that's very simple and basic when they're first born, but it continues to develop and gets more complex as they grow and develop, as their immune system develops. A microbiome is really important for our immune system. So some of it we can inherit from the mother, which is fascinating, which is super, super fascinating because when I see picky eaters now with kids, a lot of the times I'm looking at what did you eat when you were pregnant? Were you really sick when you were pregnant? What did you eat when you were breastfeeding? Or were they fed a formula? Because if they were fed the same formula over and over again, they never developed these taste buds that, for example, you would develop in breastfeeding. It's not to make anyone feel bad if you're like, well, crap, I couldn't breastfeed, so I ended up doing formula. We always do the best that we can, but we actually want to make sure that we're changing those formulas a little bit as the baby is growing to change it up, to give them new exposure. And then when we're introducing new foods, making sure that we are introducing a lot of different variety to help those bugs develop, because that's going to dictate our immune system. Literally everything starts from the gut. And the reason that I'm kind of veering off to the gut and the reproductive microbiome, but I used to think, you guys, that the reproductive microbiome was separate from the gut. It was like, oh, here's our reproductive system and here's our gut, because that's how you learn it in school. Like, here's a picture of your uterus and the ovaries and the fallopian tubes, and then your stomach, your liver, and your small intestine and large intestine and so on. But when we did the cadaver lab in our first year or second year of naturopathic school, and I remember like cutting these people open, I'm like, oh my God, all of it is just crammed in this abdominal cavity. Like your uterus is surrounded by your small intestine, large intestine, sigmoid, like it's all surrounded. And we think that there are these separate systems, and they're not. They're separated by a cell, maybe a couple cells at most. So the health of your reproductive microbiome is going to be a reflection of what's going on in the gut, and vice versa. Every woman is just going to feel it in a different place. For example, I'm going to notice my gut microbiome issues a lot faster than I notice anything in my reproductive. But I have some patients who notice a lot of shifts in their reproductive system, whether it's they get an yeast infection or a UTI. As soon as we start to do a cleanse, as opposed to get diarrhea and digestive distress. That's just how each person feels and experiences something. That's not a right or a wrong. That's your own genetic variation, if you will. But those two are really closely related because they're not actually separated. There's a lot of blood flow in that area, or at least it should be, and a lot of communication between those cells. But what I was saying is there's things that we want to be doing short term, and then there's things that we want to be doing long term when it comes to improving our reproductive microbiome and making it a nice home for that baby to be able to implant and grow and get all the nutrients. It's just a few cells. The nervous system, the first little bit, the first couple of weeks, that 6, 7, 8 weeks, there's so much development that goes on, and it's so rapid that if there's a lot of pathogenic bacteria and opportunistic bacteria in your reproductive microbiome, that fetus is so vulnerable at the beginning. It's just a cluster of cells that any pathogenic bacteria just signals it to be a hostile environment. And so that could be a reason for some miscarriages. When I talk about like miscarriages can either be an egg quality or a sperm quality thing. So like genetics, it's not multiplying and something is missing, or it's the environment. So when, even though the genetics are good and things are going along, the environment is just not right. And sometimes it's the lining, sometimes it's the pathogenic bacteria. So it's just weaning those things out and understanding what it is. Short term, I'm very aggressive with my patients when it's dealing with yeast infections, UTIs, or bacterial vaginosis, to get them like really high doses of vitamin C or zinc, whether it's cranberry juice or some herbs that are going to help to support, kill the infection. We do suppositories for yeast infections or bacterial vaginosis. So when we attack something very fast and very aggressively, it should take only a couple of days for symptoms to start to get better. It's not the same as antibiotics. As soon as you take antibiotics, the symptoms, like basically the next day, should feel much, much better. So natural is going to be a little bit slower. So we want to catch it as soon as you have any kinds of symptoms. And sometimes I'll catch it on a urine analysis that like you have white blood cells and you have, or your pH is really high, or you're really dehydrated. Let's run through this protocol now and just be proactive instead of waiting until you get symptoms. Long term though, you guys, here are the things that we need to work on. And you're going to see a theme in everything that I say because it's all related, and we want to start to understand how is this related. We have to stop looking at the bodies just my reproductive system is not working, so I guess that's the way that I am, versus like, well, what other systems aren't working? Because your digestion, your thyroid, your adrenals, your immune system, your nervous system, they're all going to be related. So long term, we really want to look at the diet. What are you eating? Are you eating a high amount of carbohydrates and sugar? And sometimes even fruit sugars can be really sensitive for people. We also have to look at the overall gut microbiome. So when I do the gut stool analysis, there's a huge connection with parasites and developing chronic urinary tract infections. So we want to probably be doing some parasite cleansing and really increasing your levels of probiotics and prebiotics. So we want to have more of the good guys so they can fight off the bad guys. It's not that there's some pathogenic bacteria that's going to be in the body all of the time, and it's not about killing all of it. It's about keeping it under wraps so then the good guys are taking over. So we actually do need to do some killing and cleansing. And then hydration is really important, and stress levels are going to be really important, making sure that you're sleeping because that's when your immune system is working and doing its cleansing, doing some lymphatic drainage support. So whether that's doing things like dry brushing or castor oil packs, saunas are really great. Even movement is really great. I have that shaker table that you can stand on and it literally shakes you up and shakes and moves your lymphatic system. Those are all really good things to incorporate to basically flip your reproductive microbiome. So there's things, like I said, we want to do short term and then things that we want to do long term. Short term, we want to be aggressive. We want to be high dose with supplements and food, nutrients, herbs, that kind of stuff, and potentially antibiotics if you can't get on top of it. But long term, because I've had a lot of you message, oh, I have bacterial vaginosis. I'm getting it every couple of months. Bacterial vaginosis, for example, is not actually a pathogenic bacteria. It's an imbalance in your bacteria. So it literally is telling me that there is an imbalance in your bacteria. And the hope with the antibiotics is if I kill everything, then the good stuff will just take over. That's literally the hope. But in order for the good stuff to take over, you actually have to feed it. So probiotics, for the most part, like maybe you get recommended to go on a probiotic, maybe you don't. And if you do, you're taking like 10, maybe 25 billion, where you need to be taking like 100 billion for a month as opposed to a week. And depending on how much sugar you've consumed or fruit, like changing your diet, it's not something that you need to be doing for the rest of your life. But when you're trying to reset your microbiome, like your entire microbiome, we need to be a lot more aggressive with our approach in terms of our supplements, in terms of what we're doing with our diet, and even how we're supporting our microbiome with natural therapies. Like I said, the saunas, the castor oil packs, stress reduction, increasing your sleep. And I want to bring this to your attention, you guys, because I think a lot of people grossly underestimate what we actually need to do to flip and turn this microbiome around. And I, like now as a natural fertility expert, I spend a lot of time and energy with my patients optimizing their reproductive microbiome. And when we first start doing some cleansing, I'm shocked by how many people get discharged. Women will just get the grossest discharge in the first couple of months of us working together, around their period or not around their period or around ovulation. It's like there's no signs of infection, but this is like green, weird, slimy discharge or actual passing cysts and clots that are like, I've never had any of this. And that's just a sign like we detox through our menstrual cycle. That is a way that we as females detox. So if you have a lot of heavy cycles and really clotty cycles, that tells me your detox is compromised and your body is not managing. But when I'm working with my patients and I'm actually like pushing that detox, I look forward to that because I think of it as like, yeah, your body's cleansing, your body is getting rid of this stuff so then it can make this nice home for your baby. And that takes time. It just takes time. It's minimum 3 months that you want to do something with the gut. But if you're trying to shift hormones with that and really improve liver function and gallbladder function and reproductive, you're looking 3 to 6 months of some really good detox work and increasing nutrient levels and improving your diet and sleep to notice a really big shift. But I promise you guys, you need to be feeling better. You will be feeling better. To me, I rather put in the work and not have the discomfort of the bacterial vaginosis or the yeast infections. Like I used to get yeast infections all the time in high school when I was on birth control and never put the two together. It was just like, I guess I get yeast infections now. I haven't gotten a lot into the reproductive microbiome testing yet. There are some really great companies out there, but I do test a lot of the gut and I go from the gut and kind of the symptoms and what's going on. When I work with my patients, they've been struggling for 2, 3, 5 years on average. So we need to get that information and get those answers so we can be really proactive and very specific with the support that they need. And the reproductive microbiome, like I said, is one of those that we focus on quite a bit. So I hope you guys found this helpful. I will record more podcasts around like specific UTIs and yeast infections. And if there's any other questions that you have about this, please let me know. Like I said, there's so much new research that's coming out and I don't think there is enough information about it quite yet in the public's eye. And this is something that I am trying to get out because to me, it makes a lot of sense. If you have pathogenic bacteria, how can your baby grow in a place where there's a lot of inflammation and a lot of pathogens? It's like, it can't. We're not looking at the baby. We're looking at just a couple of cells, and a couple of cells, it's such a fragile time in development that everything has to be perfect, if you will, or as perfect as it can be to make that happen and set that foundation. So the reproductive microbiome is an important topic and I will be talking more about it. So thank you so much for tuning in. If you know somebody who is going to benefit from this information, I'd love it if you share this podcast with them or share it on your feed. I appreciate every single one of you for tuning in, listening, sharing this podcast. Thanks so much for being here and I'll see you next week.